4 exercises for facet joint related back pain with Dr. Novoltz. So facet joint related back pain, often called facet joint syndrome or facet joint disorder, often takes place in the lumbar spine. And it's when the joint and the corresponding nerves and ligaments and muscles are not working properly, and that causes pain either right at the joint, or sometimes it can refer into the butt or even down the leg. It's important to remember when we're going through these diagnosable conditions that one of the best ways we can prevent and help treat these is through movement. And so a lot of times after people get diagnosed with this condition, they get scared to move. And so it's really important that gradually and progressively allow people to move in more complex ways so they recognize that actually motion is lotion, and that's what's really needed. Also, a lot of times, not so much with facet joint syndrome, but with other conditions, there'll be corresponding imaging. And so in that case, we must remember that there's plenty of people that have imaging that shows that they have some sort of degeneration or arthritis, and they actually don't have any pain. So imaging abnormalities are actually normal. It doesn't mean that you're going to have pain. So keep that in mind as we go through this. So the 3 components of facet joint pain are the actual facet joint. There's a couple joints in the spine. The primary ones are the disc is a joint between each of the vertebral segments, and then towards the back of the spine, and is positioned in a certain way to allow movement for the spine. So in the lumbar spine, this primarily allows us to bend forward and backwards. There's nerves that go directly into this joint and help with motor and sensory activation to that joint. And then there's the muscles that overlap over the joint as well. So when this is aggravated, all of those are contributing to that. So in the clinic, we often use orthopedic tests to diagnose facet joint pain. So I won't go through all of these, but I'll just mention that the orthopedic tests that are the most useful are the Kemp's test, segmental rotation, the spring test, and Yeoman's. So all those can help to determine if it's the facet joint that's causing back pain. So the exercises that are most often used for facet joint related back pain are the hamstring doorway stretch, a glute bridge with band, the sidebridge, and dead bug. So how to do all of these exercises? So it's best to do all of these exercises with awareness. That means don't be distracted as you do them. Breathe, keep the breath full as you go. And even though we're focusing on the low back, feel a full body engagement all the way from the hands up through the feet. Keep your entire body engaged. And you definitely want to feel like you're efforting, but not too much. And you also want to be careful and not overdo it. So starting with the hamstring doorway stretch, you'll begin by finding a doorway or some way that you can have both legs straight, one leg up the wall, and one leg either in the doorway or at the edge of another wall. And so begin on your back and bring the leg in that you want to stretch, bring that knee towards the chest, and then begin to slide that leg up the wall. When it gets to the top of the wall, toes of the foot towards the head, or dorsiflex the ankle, and then feel the stretch along the back of the leg. The next one is the glute bridge with a band. You can do this without a band, but the band creates a little bit more challenge and resistance. So you're going to want to lay on your back and bend your feet in so your heels are close to the buttocks. You'll take the band and you'll put it around your hips, and then you'll fasten the band to the floor with your hands. Push into your feet and allow your hips to come up, pushing against the band, bringing the hips in line with the knees. You can hold with the knees. You can hold here, or you can do reps, creating some strength in the low back here. Next is Sidebridge. There's 2 variations for this. This is the simpler variation where you're on the knees and the forearms. So start on your side with the hips and the knees on the floor, and then gently press into the forearm and the knees and lift the hips up, finding your balance here, either holding here or again doing reps. Last one is the dead bug. So you're laying on your back, the arms are up over the chest, and the knees are over the hips, and the ankles are in line with the knees. You can stay here, just kind of relaxing in this position, or you can move the opposite arm and leg, extending the arm and leg in opposite directions, parallel with the floor. And then bringing them back and doing the other side. So those are the 4 exercises that are used for facet joint syndrome. In general, it's usually recommended to do 3 sets of 10 reps. This, for everybody, really what you're trying to accomplish with the reps and sets is to challenge yourself. So to do at least like 60 to 80% of your effort, so that you feel like you're efforting, you can adapt, you can get stronger by doing the exercises. If you're not pushing yourself hard enough, you won't get the benefits. But if you push yourself too hard, you can run the risk of setbacks. So one of the ways that you can create more challenge for yourself is through variability. So maybe using weights, using more bands, doing things that change exercise to give yourself more of a challenge. So that's what I often do. I help you find the hardest exercise that you can do well. That's a lot of what I do in the clinic, and so I'd be happy to do that for you if you've either tried these exercises and don't feel like they're helping, or if you'd like a little bit more customized, personalized approach. So my approach consists of 3 phases. There's the reset phase, the reinforce phase, and the retrain phase. So exercises like this are part of the retraining, so building strength in these areas. The reset includes hands-on adjustments, soft tissue work like massage, any other modalities that I may use. And then, as I mentioned earlier, pain is multifactorial. So sometimes we reinforce this with stress management techniques, helping you improve whatever other wellness practices can get you out of pain quickly. So that's the general approach. So hopefully these exercises work for you and you don't need to come into the clinic. If they are going to work, you usually see results within the first 7 days. If you're not getting better, or if you need a little bit more advice or a second opinion, go ahead and schedule with me, and I can help you and guide you and create a personalized plan just for you. So thanks so much for watching. I really hope that you found this useful, and I look forward to working with you in the future.